Well, good afternoon, SLAE family. This is going to be a really compelling conversation. I'm so grateful to our special guest today because we are all bombarded with a lot of information right now regarding COVID and the Delta variant and all that's circulating in regards to this pandemic. And today we are so blessed, and I mean truly blessed, to have a special guest. We are very social distance. I'm in Maryland and she's in Ohio right now, but I'm going to have the pleasure of introducing you to Dr. Yvette Casey-Hunter. And Dr. Hunter is beyond qualified to have this conversation. She is going to talk to us about what's happening right now. And at the end, we will even have an opportunity for you to ask some questions. So first and foremost, thank you so much for joining us today. And since not everybody knows you, obviously, could you please take a minute, just share your professional background, how long you've been practicing medicine, what you are currently doing. I think that's a great way for them to learn a little bit about you to start.
Well, thank you so much, Ms. Gabriel, for this opportunity to address your audience and our respective colleagues. I'm a pediatrician by training, a physician. I graduated from Howard College of Medicine in Washington, D.C., and then did my pediatric training at Baylor College Affiliated Hospitals in Houston, Texas. But decided if I was going to open my own practice, I was going to move back to Cincinnati, where I was at least known. So I came back here in 1981 and started a practice in 1982, and was in private practice for 20 years, and then joined what's called a federally qualified health center as a, which is a public funded entity, nonprofit, and gradually worked my way up as their pediatrician to become the chief medical officer. As such, I supervise all physicians, all categories, all clinical specialties, and provide clinical leadership for the organization.
Fantastic. So you've got a good 40 years of practicing medical under your belt, and you're a chief medical officer. You've got a background in pediatrics, so you're very equipped to talk about vaccines and kids and teens. And also WinMed, the place where you are the chief medical officer, they've been providing a lot of COVID services and testing and vaccinations, correct?
Absolutely. When COVID first started, we looked at it like, wait a minute, what is this? You know? And then after we kind of caught our breath and said, okay, we've got to do what we need to do. So we instituted immediately a triaging system in our in how we saw patients, screening people at the door, as well as wearing masks and socially distancing. We instituted telehealth medicine for the people who we felt would be safer not coming to the office to get their chronic care monitored for their diabetes, their hypertension, et cetera, as well as triaging people acutely ill to make sure what their process might be and what would be the best disposition for them.
So I'm going to kind of kick this off with a lot of the things that people wanted me to ask you about.
Okay, wait, one more quickie thing.
Oh, so please, yes.
The other thing is, in June of last year, we instituted rapid, what we call point of care, meaning in 15 minutes, you know your results. We started doing that, and as a collaborative effort with other FQHCs in our area, we tested over 7,000 people in about a 2-week time period in the Cincinnati area. We also offered as a backup what's called the PCR test that takes 2 or 3 days. And then last December, we started giving the COVID vaccine. We were doing the Moderna. And so we continued that. And we've continued to do the vaccinations as well as the testings throughout 2021.
Outstanding. Okay, so COVID came and it, ramped up, and then it looked like things were getting under control and people were starting to open things back up. And now came the Delta variant. And I feel that, many people say they're basing their knowledge, I'll say it like that, on what their friends tell them, what they hear on the radio, what they hear on TV, but they're not really having a conversation with the medical professional. So asking you, here's what people want to know. Number one, Is it that much more contagious? And in addition to that, is it as dangerous health-wise? Like some people are saying it's more contagious, but you don't get it sick. Some people are saying you get more sick, but it's not as contagious. People don't know. So you're a professional. What do you see and what do you know that you can help everybody with?
Well, first of all, let's look at things. Since COVID began, over 680,000 people have died. Now, I don't know of any other process except for war and bombings or the Holocaust where that many people died in that short of time period. So we have to look at it from that perspective. This is very lethal. Secondly, we have to look at 37 million people out of the United States now have had COVID infection since the beginning. So that's horrible enough as it is. But now the Delta variant is much more what we call in medicine virulent, meaning it's much more strong, it's much more contagious, and it causes more death and disability and disease process than the previous one that we started out with. So I say all that to say this. We now have people who have been immunized. We always knew that the vaccine would give us protection, but not prevention. The difference is prevention will keep you from getting it at all. And protective will keep you from getting as sick as you would be if you had not been vaccinated. So the fact that now we have people who have been vaccinated, who have still gotten in contact with the Delta variant, who come down with it, tested positive for COVID, had to self-isolate, self-quarantine for 10 to 14 days. This thing is not going away. It's getting worse. It's ramping up. And now the hospitals are filling back up. 95% of the people in the hospital with COVID now are unvaccinated.
Really? That's how high the statistic is?
Really, that's how high it is. So that's extremely risky. And the problem is that you may consider yourself, not you personally, Ms. Gabriel, but a person may consider themselves basically healthy. I'm healthy. I don't have any of this. I don't have that. I'm okay. I'm not in the high risk category. But you're around other people, and the other people you're around, you may not know what their immune status is. Meaning their ability to fight off infections. You may not know if they've got HIV or they're on chemotherapy for cancer, or they have chronic steroid therapy for autoimmune diseases. You don't know that about other people. Mercifully, we don't wear labels across our head as to what we suffer from.
Sure.
And so you can carry it to somebody else. It's like, let's compare it to stuff that we already know. Let's compare it to chickenpox. Okay. If you had never had chickenpox and you got exposed to chickenpox, you were contagious, meaning you could spread it to other people for up to 21 days before you had your first pox show up. That's why it would spread through a classroom so fast. But once you'd had it, you never could carry it again to somebody else. So if you had chickenpox and you got exposed to it again, you couldn't get it again and carry it to somebody else. COVID's not acting like that. COVID doesn't care if you had COVID before. You can get it again and carry it, and especially as it becomes this Delta variant, you can then carry it to other people. So this is a whole different set of circumstances, a whole different process.
It is interesting what you're saying, because when I was young, my brother had chickenpox, came home, we all got it. That's kind of the way it went, ripped right through the family. But I live in Maryland, and the famous quarterback of the Baltimore Ravens has had COVID twice. So we do see that it is repeating. Now, I think your chickenpox analogy is really powerful. And what you were saying about being vaccinated, a lot of people have hesitation about being vaccinated. Personally, and I don't mind putting myself out here, I did it immediately when it became accessible. And my primary concern, honestly, at that moment in time, I thought, well, I'm really healthy and I work out and I take care of myself. But I I see an older relative that every weekend who's in his 80s and is very vulnerable. And I couldn't live with the thought that I might give it to him. I was more worried about giving it to him than even myself at that time. So, I think your point is really strong. Now, there are people who are getting it. There are people who are not getting it. And I want to get into the nitty gritty here, Dr. Casey-Hunter.
Okay.
Okay.
So
Let's go. People who are not getting it. And again, I know there are there are reasons some people might have medical reasons, but there are two things that I think maybe you can shed your perspective on for maybe someone who is on the fence. Number one is speed. I've heard a lot of people say, I'm not comfortable because it hasn't been around long enough. The vaccine hasn't been tested enough. It just got approved. And that's their primary concern. The second thing is that there are a lot of people who are resistant to being told that they have to have it when it's not for religious objection or anything. They just generally don't like that. So what would you, with your 40 years of experience, say about those things, and what's your perspective?
Okay, let's look at it this way. Okay, let's look at something people are more familiar with, and then we'll come back to COVID, okay?
Sure.
As a child, I got the smallpox vaccine. That's that little thing, they scratch your arm, you get a sore and you get a scar. We eliminated smallpox in this country because everybody got the vaccine. So there was no host, nobody who hadn't had it for the organism to live in. So the organism died out. Now, nobody has to get it because we don't have it anymore in this country.
Sure.
When I was a kid, also, a lot happened when I was a kid, obviously. When I was a kid, Dr. Sabin's oral polio vaccine came out. And that was really important because there were kids who were devastated by the polio epidemic. So I remember going on a Sunday morning to get the vaccine, and on a school day to get it in junior high. And I looked at one young lady who hadn't gotten in line to go get it. And I said, "Oh, my dear, aren't you going to get the vaccine?" And she said, "I don't have to get it because I already had it." We all lived in Dr. Sabin's neighborhood. So neither she nor I knew about clinical trials at that point, but they had gotten all of the kids in their neighborhood to get the vaccine as part of the workup for it.
Wow.
So, and since I've been a physician, I've seen two dreaded diseases eliminated because of vaccinations. One being H. flu meningitis and the other being pneumococcal meningitis. So I can truthfully say that I see an advantage to the immunization process. And what it is your body gets exposed to a very mild form of the disease. And then your body says, "This does not belong in me." And you start to build antibodies to it. And the purpose of it is that when you then come into contact with it in what we call in the wild, meaning in the community, then your body will be already primed to start fighting against it. So that if you do get it, you'll get a much milder case, or you won't get any symptoms that you'll recognize at all. So that being said, number one, we got to remember that COVID's only been around for a year and a half.
Seems like forever, I must say, but yes.
Yeah, it feels like forever, yeah. But the whole purpose, the reason for working so diligently towards it is because it's so lethal. It was killing so many people. Like I said, an act of war is the only thing that's killed that amount of people in that amount of time. And we're not even talking about the people who are going to have chronic conditions afterwards as a result of having had COVID. So at this point now, 37 million people have had a pre-existing condition, COVID. And we just don't know what the long-term effect is going to be. So that's point number one. Point number two, there is a process that the FDA and the legislatures have set up that everybody has to go through to get that vaccine approved. And those are the clinical trials where they've shown that it really made a difference. People had protection and so forth and so on. So they issued it under emergency use authorization, meaning that it was just so critical to get this out there for people, because so many people were dying and so many people were sick, and the healthcare system was overloaded and everything was about to really crash, not only economically, but socially, everything, that they approved it for emergency use, which meant it was voluntary. Now, Pfizer just this past month has passed its final clinical with the provision that they would continue all the clinical trials and testing they were supposed to do before getting a final approval. Pfizer vaccine just got their final approval this past couple of weeks. So that means they've passed all their everything, they've been vindicated and so forth. It's not too rapid. Moderna probably will follow pretty soon, as will Janssen and Janssen. But for now, if people are hesitant, they want to make sure it's all vetted and stamp of approval, then they can ask for the Pfizer vaccine and get that. But thank God we got it speedily, because so many people were being affected and dying. And I must say that the Delta variant, unfortunately, is also killing people who have been immunized. So people who have had pre-existing conditions that put them at risk, even though they've been vaccinated. If they come around somebody who does not have the vaccine, that means they can carry it, the exposure to somebody else. They are coming down ill with it and dying from it as if they had not been vaccinated. Oh. So we're not just trying to protect our individual selves, we're trying to protect our loved ones and the people we work with and the people around us and the people that they're in contact with. It's like throwing a stone in a lake. You see the ripples go across. We have no idea how many people can be affected by one index case. So it really is important to get it done.
So
really.
This is such a great conversation. And, you know, we're talking about how it's spreading and about the fact that it's gone through the process now, and now it's being implemented in a lot of places. It's really interesting around the country. It's so wildly different, you know. So for us here, my son, you know, goes to a private school, and they sent out a notification for the upper school kids that they can't come on campus now if they're old enough to have the shot and they don't have it, and they're going to have to do virtual school. But then again, since I'm telling you, I'm in Maryland, last night I stayed up way too late and I was watching the Ravens game, and the Baltimore Ravens were playing in Las Vegas, and the stadium, there must have been 70,000 people. It's a brand new stadium, first season game. And I don't think I saw anybody with a mask. So when people see, okay, here it's, you know, you need a mask, you got to be vaccinated, you have to do this, and over here they see, you know, it's wild and everybody's like, forget it, you don't need any of that stuff, you could do it. That, I think, is breeding more confusion and resentment. So what would you say with all of those things that people are being hit with, if they're a parent and they're trying to decide whether to get a vaccination for their teen? You are a specialist as a pediatric physician. What is your take on that and providing this for teenagers?
I am thrilled that we've gotten the approval down to age 12 years. And our organization started out with the Moderna vaccine because the storage and the shipping quantity was something that we could manage. But now that Pfizer has been approved down to adolescents, we've now stocked the Pfizer and we're starting to immunize them as well, so that we can get families protected. After all, we have younger age, they're teenagers and families, but they have younger siblings who aren't eligible for the vaccine, and they can give it to them. And we're seeing more and more kids wind up in the pediatric hospital ICUs and beds with COVID because other people around them were not immunized who could have been immunized. So
can I jump in here for a minute? Because in the beginning, the word on the street, so to speak, was that with the original form of COVID, it was not really impacting kids. But what you just said is that you're now seeing children, I don't know, it's the Delta variant, I assume, but you're seeing kids in the hospital, you're seeing children in ICU?
Absolutely. Absolutely. And, you know, I'm seeing video clips from interviews from around the country, different hospitals and stuff. And they've talked about how many of the kids are in the hospital that have COVID now. And the other thing that I saw recently was, because the hospitals are full of people with COVID infection, they can't admit people with regular processes that would need to be in the hospital, like cancer treatment and surgeries that are needed, you know, because there's no hospital beds left. And so that's something. But can I talk about masks for just a quick second?
That was where I was going to go next. So okay, please, let's talk masks. Yes.
Because the reason why I said that, because, recently, during our office team meeting, one of the staff people said, if the governor says that we don't have to wear masks anymore, do we have to still keep wearing masks? I said, absolutely. I said, because the pandemic is not over. And we have to still keep our practices in place that have kept everybody healthy. In the year and a half since COVID started, we have had some staff to have COVID infection. Not one of them contracted it on the job. Not one, not one. They contracted it out socially. They've been out to restaurants. They've been to parties. They've been to other social gatherings. I don't want to be specific. But and because I'm the chief medical officer, I have to investigate and interview them and see where the contact might have been, because then I need to know what is the risk to the rest of the staff. And so just as if a patient had come in, or a vendor had come in, or somebody just came in to ask directions and they had COVID, you know, I need to know what the risk is to our staff. And not one had gotten it on the job. So masking makes a big difference. The other thing is, a lot of the other respiratory diseases that are around during that same time frame, like the flu and community acquired pneumonia, the incidence of those went way down because of masks. People weren't breathing on each other. They weren't congregating in tight places. So let me just talk about masks real quick, okay?
Please, yes.
So I don't care whether it depends upon your level of exposure and your level of comfort, okay? But this, hopefully y'all can see it. I'll try to turn it around. This is a surgical mask, okay? And it basically fits on like this. And that's it. You pinch your nose, that's it. And this is good for just, I'm running out to the store, I'm going wherever, you know, okay? Then people are into color coordination. I'm not, but that's okay. And I say, that's fine. Just put your regular mask on first, and then put the color one over it, you know? So if you want to be color coordinated, so you can wear a cloth mask, but a cloth mask is not going to filter out the viral particles sufficiently. Now, for those that watched the Olympics, they saw in Japan this year, everybody was wearing N95 masks, okay? And they're a little bit more heavy duty. They still fit basically like the other, but see, not really. And FYI for us mature ladies, I found that wearing a mask can cover a double chin. So the thing is, pick your flavor, but what you want to do is prevent people breathing on you and you breathing on other people. And that's what it's all about. To try to go ahead.
Say, yeah, because this is interesting what you're saying. Well, when I go to the grocery store, there's a cashier there, and she has, I call it the disco ball mask. It's like all blinged out with all kinds of stuff on it, you know. Yeah. Does a cotton mask do nothing? Is it just less effective? Like on a scale of 1 to 10, it's a lower number. If a 10 is completely effective, is it worthless? Does it, you know, what is the take on all these different masks? Because not everybody can get medical grade ones. And in the grocery stores here, they even sell those little packs of almost disposable looking light blue ones. So weigh in on that if you would, since we've got
okay. Those light blue ones are actually surgical masks.
Okay.
It's equivalent to this black one that I just showed you. That's just, you know, it's just sort of flat, you know, it's like an accordion sort of thing.
Yes.
that's good for basic protection. But if you put that the surgical mask on and then put your cloth mask on top of it, it will camouflage it. Nobody will see it, and you're still, you know, in style or whatever. Okay. The other thing about the cloth mask, you have to wash them first because they do have manufacturing residues in them. But here's the thing. I got all 3 of these on Amazon. So now what happened originally when the pandemic first started, there was a shortage of these in this country.
Yes.
And so we couldn't get them. Now they're more plentiful. I wound up having to buy some at the local pharmaceutical retail place, pharmacy, in order when it first started, because I was trying to save the PPE, what we call personal protective equipment, for our staff who were actually directly seeing patients. But that's okay. And if I'm going to the office to see patients or to see the staff, I'm putting on my N95. But if I'm just running out to the market, I'll put the surgical mask on. It breathes easier. One other thing, having people in your car. Definitely, if you're traveling with somebody else, somebody has to have a mask on, because otherwise you're definitely rebreathing each other's air. And then I disinfect my steering wheel and my knobs and stuff with the wipes when I'm getting out of the car, because there are other people who park the car for me, so that I don't expose them to my germs. They don't expose me. I carry hand sanitizer in my car. I carry the wipes in my car, so that we can constantly be doing that.
Okay, fantastic. Now, the booster situation here, you know, we're hearing a lot about a booster is going to be required, recommended. You know, what information can you share about the booster shot?
Okay, let's just, first of all, let me just say, looking at things as we said before, there's nothing new. It's just a new disease that we're applying our past processes to. Okay. We started out getting only 1 measles shot. Then we found out that it doesn't give lifelong immunity. Then kids had to get a booster before they went to kindergarten. And now we're finding some are needing to get it in adolescence as well. So there's nothing new with that. We found, we just didn't know whether the protective, remember it's not preventative, but protective antibodies from the vaccine would last long enough to get us through the pandemic. And we're finding that it's not. So when the recommendation first came out, it said for people who are immunocompromised, that means their immune system is not up to normal status because of some process that's already going on. Either they're a kidney transplant, or they're on chemotherapy, or they've got a chronic disease that on the medication that's suppressing their immune system. So they needed an extra vaccine dosage in order to really create complete immunity as it was expected. So it was then called an additional dose, just like some vaccines started out, you get 1 dose and then they decide, no, you really need 2 doses. And then they decide, no, you really need 3 doses. So that was that. For people who are immune competent, meaning their immune system is normal, they don't have any other process going on challenging their immune system, they decided that a booster, which is meaning they got you to the expected level of immunity, but now they want to kind of raise it up a little bit higher to get you a little bit more immunity. So basically it just means everybody needs a 3rd shot. And when do you think that got the Pfizer or Moderna? Okay, with Janssen, who got the Pfizer or Moderna vaccine, they both need a 3rd shot. They haven't said that for the Janssen and Janssen. So and is that something that you see someone will need it, you know, 6 months or a year, or what's the projection on when people get that? It's 8 months after their second, well, for correction, for the people who are immunocompromised, they need to get it within 3 to 4 weeks of their second, their second shot. Okay, for people who are immune competent, they're getting that booster 8 months after their second shot. So we'll start giving out those boosts. We've already started giving the shots to the immunocompromised last month, and we are starting our first go round of immunizing the people who are immune competent with their booster the end of this month, beginning of October. So that's 8 months out. Mhm.
Okay, and then the last question, and after this, we are going to do a little Q&A, but the last thing I wanted to just ask you is, you know, again, there were people who couldn't get the vaccine fast enough. As soon as it was out, they wanted to do it. There are people who are going, there's nothing you could say, nothing you could do that, you know, will have me get that vaccine. And then there's the middle. And as I mentioned earlier, the middle is, you know, fear about, you know, the medical research or competence of the shot, resentment or not being told what to do, politics plays, I mean, it's crazy. You would think that people wouldn't decide based on politics, but there's politics in it too. There's a lot of reasons that there's some people who are like, well, I might not. So, you know, I'm sure that there are people watching this right now that fall in that middle group. I don't think you're moving this group, and I don't think you're moving this group. So, you know, what would you say with your experience? Is there any message that you want to send to somebody? Because obviously you are very passionate about people getting this. What would you want to communicate to them?
Here's what I want to say. You just don't get a do-over. You don't get a do-over. This is not like that movie Groundhog, where every morning the guy woke up and it was February 2nd all over again.
Yeah.
You know, if you decide that if you decide you're going to get the vaccine and you still get COVID, or people around you still get COVID, you at least did all you could to protect yourself and to protect the people around you. If you don't get the vaccine and you get COVID, you're going to carry that to everyone around you. And if a loved one gets it from you and passes, you just don't get a do-over. You know, if a loved one gets it from you, and it's not that people intentionally carry it to somebody, but it's what happens. It's what happens. It's the nature of this disease. And if they get it from you, and they have a long-term disability afterwards, or somebody that they love dies as a result of getting it, you just don't get a chance to say, hey, let me turn back the clock and I'll take the vaccine. You know, you just don't get a do-over.
Yeah.
And I try, my personal thing is I try not to live with regret. I try to make the best decision I can for myself, for my family, and to go forward in that, and to try that. I know with every decision there are rewards if it turns out great, and there are consequences if it doesn't. But I try to live in a way that if there's something I can prevent harm to other people, I want to try to do that. And I think that we all need to realize now, as I'm realizing, that now it's over 680,000 people have passed from COVID. But now 2 of those people have a name and a face for me that will never be in my life anymore. And we just need to bear that in mind. And the other thing, the last thing, is that as the number of people who are immunized begins to grow, and the number of people who are not immunized begins to concentrate, begins to shrink, that virus is going to concentrate, because it's going to stay longer in that host before it can go to the next one. And so succeeding waves of COVID are going to be stronger, more potent, and more deadly than what we have now. So I urge everybody, I'm not going to tell you what to do. I've seen deadly diseases and consequences eliminated through vaccinations, but I'm not going to tell you what to do. But I'm asking, search your own heart. Can you live with it if somebody gets it from you and they can't live?
That
Thank
is
you so much.
powerful. Yeah. Well, I thank you. I'm sorry for your loss. We lost a family member to COVID as well. So I'm so sorry for you. And I really appreciate you getting into this because in many ways it's controversial, complicated, emotional for people. So I want to thank you for taking the time to be here. Now we have people who are watching this in two different formats right now. At this very moment, we are live in our Facebook group. If you are live in the Facebook group, we're going to go off camera now and you will be able to post questions. And Dr. Casey-Hunter has been kind enough to say she'll stick around for a little while. And if you want to post questions underneath this live, then she will answer the questions and dialogue with you. And she's also part of the Facebook group, so you could message her. If you're watching this on YouTube, which will be in a few days from now, you can leave comments down on the YouTube and we will check back with that as well so that she can help. So thank you again. Bless you for your incredible work and for all the things that you do, because I know that you provide medical services for a lot of people who wouldn't otherwise access it through WinMed, excuse me. So I appreciate you so much. Thank you for being here. And I'm sure you will help everyone with their questions as well.
Thank you so much, Ms. Gabriel, for the opportunity to present this information.
Thank you, everyone. Be safe, be healthy, and we will see you next Tuesday for sure. Take care.
Bye-bye.